I think we're going. I think we're going. All right. So this is a very impromptu live stream. We do not have a producer working with us this evening, but we do have a doctor in the house who is willing and able to answer.
Definitely willing, and I can be able.
He will be doing his best to
Sure.
answer coronavirus questions. So we did ask for people to send in questions to Bellator ahead of time so that he could prepare a little bit.
Mm-hmm.
So we do have those questions written down. I have them on my handy dandy papers here. So I'll make sure that we ask him those questions. But if you have questions during the context of this live stream, you can send those, just type them in, and we will try our very best. As best we can.
We'll try to, yeah, it's like a question, if it pops up.
I'll write it down.
Okay.
I'll be the secretary and try to write it down.
Okay.
All right,
Sounds
so
good.
we need to do a little bit of introduction. This is Dr. Matt Jaeger.
Hi.
He is also my husband, which is why we got him at the last minute.
I'm a pediatric emergency room doctor by trade, and I've been practicing here in Nashville for the past 2.5 years since we've moved here. So I work in an emergency department. I actually work in two different emergency departments right now. One is a regional community hospital, and the other is kind of a tertiary care pediatric hospital. So
if there were to be coronavirus, which there now is in the state of Tennessee,
Yeah.
you're gonna see it.
And honestly, I tell folks I probably already have. Even though we've only got at the moment one confirmed case of testing positive coronavirus, I think it's actually quite possible that we have dozens, if not hundreds, of more cases that are out in the public right now. We just have no idea because the cases have been mild and we didn't test for them. So in all honesty, probably I've already seen a case.
Okay.
And she, as I say that, she's thinking about burning my scrubs.
I already think about burning his
When I
scrubs
come
on the
into the
regular.
emergency department, yeah.
Not surprising. Okay, so let's just start from the very beginning. What is coronavirus? What is COVID-19?
So I think there's a bit of some poor understanding by the general public on this because we've had coronavirus for years. I mean, we identified coronaviruses close to 50 years ago as people were starting to do research in virology. So coronavirus is one of the many viruses that causes kind of common cold symptoms. So we've had 6 or 7 different strains of coronavirus that we've identified over the past 50 years since we've known about it, and it is now. There was a new strain of coronavirus that was basically within animals that had a genetic mutation and popped over and can now infect humans. And kind of similar, if everybody remembers the H1N1 swine flu, it was the exact same situation. We have multiple strains of influenza virus. So we have, different types of influenza A, different type of influenza B. Each of those has multiple different strains. And so every year there are a dozen, or more different types of flu that are floating around out there. And in the year where we had the swine flu epidemic, one type of flu flipped over that had previously just been infecting pigs and now could also infect humans. And so it was a big year for the flu, and everyone kind of caught it because we'd never seen it before. It was a high infectivity. And that's exactly what's happened with coronavirus. It's just one new strain within a family of viruses that we've seen and treated for years. I mean, I literally every year patients have tested positive for coronavirus that I've seen in the emergency department since as long as I've been practicing. We see coronavirus all the time. So this is just one new strain of the coronavirus that popped up this year.
Awesome. So how is it different from a cold or flu virus? Like you hear people saying, or I hear people saying because I'm on the internet and you're not because of Exodus 90.
Right. I am reading for work purposes.
Yeah,
but I'm
you're
not
reading what your hospital and the CDC send you and things, but you're not reading the things that I'm reading, like on Facebook.
Right.
Saying, there's like a spectrum of people saying, it's the most terrible thing in the world. No, they're hiding things from us, and then the other end of the spectrum is saying it's just like a cold or flu virus.
Yeah.
Is it just like a cold or flu virus? Is there a difference? Is it more or less contagious and or dangerous?
So it really is a cold and flu virus. Like, that is exactly what it is. And from some of the early data that has come out, there have been the way we're collecting data right now, and the way that we know of these patients in China. The most sick patients are who has been getting tested now. In some places they're doing more widespread testing, but certainly here in the United States, mainly the people who have been tested have been the very sick. But what we know about the virus is that it does spread very similar to the flu. It does often show symptoms that are very similar to the flu. And so some people can have a mild case of the flu, and some people can have a really severe case of the flu. So it behaves very similarly. I have heard some sources have told me that it tends to cause more just fever and cough and lower respiratory symptoms, whereas influenza virus, you get a lot of runny nose, sore throat. Children sometimes get vomiting. And I've heard some differing things on that, but it tends to be, at least the people who are getting sick from this virus are getting severe lower respiratory symptoms. But is it
lower
different?
Or upper respiratory?
Lower is what
does
has
that
been.
mean? I don't know the difference.
So when you think of upper
This
respiratory,
is my respiratory, like my nose is.
here's your upper.
Okay.
Here's your lower.
Okay.
And so cough, sore throat, and runny nose would be upper respiratory symptoms. Lower respiratory symptoms would be cough, wheezing, shortness of breath,
Okay,
that kind of thing.
Okay.
So yes, it actually functions. From what we know now, it functions very similar to the flu virus, and that's the way I'm thinking of it. In terms
like
of
more than a cold, but kind of like the flu.
Right. I mean,
Okay.
so what are the viruses out there that cause common cold symptoms? Flu, we consider a common cold virus, essentially.
Although flu is harder than like just a regular cold,
I mean, it
right?
stinks, right?
Yeah.
But I mean, you've got rhinovirus, you've got enterovirus, you've got coronavirus, you've got metapneumovirus, you've got RSV virus.
There are a lot of viruses.
There's all of these viruses.
Yeah.
They're all causing these respiratory symptoms.
Okay.
They all have a similar way that they manifest, and some of them a little more severe than others.
Okay.
But coronavirus is just one of those many viruses.
Is this an epidemic?
So, epidemic is a specific term.
Is it a pandemic?
So
what are those things?
So an epidemic is when you see a sharp rise in the number of cases of whatever disease. So when you have, and then a pandemic on the other hand is when it's kind of a worldwide increase in these symptoms or in this disease coming out. So the CDC and the World Health Organization will tell us when we've hit pandemic levels. We're not quite there yet, as far as I've been told. Okay. But it's basically, are we seeing an increase in this virus? Yes. So is it an epidemic? Yes, it is. Has it reached pandemic proportions? Not yet. Will it get there?
In the United States, because China, it's
pandemic.
Is the world?
Is world.
Is the world?
Is world. So
Panera is the world.
Right.
I'm going to ask the hard-hitting scientific questions tonight.
So we're not to pandemic yet.
Okay.
But I think we'll get there.
Okay.
But I'm not afraid of that, and I guess we'll get to that here in a minute.
Okay.
But yes, we're headed that direction.
Okay, so let's go there. Should we panic?
No.
Okay.
No, we should not panic. And honestly, I really want to stress this to everybody out there. Do not let the panic and the fear that you're hearing across all sorts of different media outlets cause you to change the way you're living your life, because we have seen this viruses like this pop up multiple times in the past, and there are ways to be sensible, there are ways to be prudent in the way you go about your life, but honestly, they're the exact same things that I would tell all of my patients to do every year previously as we move into cold, flu, and virus kind of season. So I'm not changing anything I'm doing right now as far as my life and our day-to-day life. We're doing exactly the normal thing we've always done, which is try to be prudent and not catch a virus when here in the middle of winter. The rest of it, I think it is a byproduct of our media right now and our culture and social media that everyone is moving with an abundance of caution, and everybody's kind of one-upping the next person in what I'm doing to be safe. And I think our leaders as well, our health department leaders and our national leaders, everyone is trying to be abundantly cautious, and nobody wants to be the person who doesn't do enough.
Yeah.
And so I think that's why you're seeing this anxiety level rise and rise and rise. When for the layperson, those of us just going about our lives, honestly, we should be going about our lives just like we would every year during cold and flu season, which is, again, washing your hands and
maybe if we weren't doing all that stuff before, we should start.
Yeah, I mean
maybe some people shouldn't go. I guess along with what they always
there are
did.
certain years. Yeah, there are certain years where I'm trying to tell people just leave your, stay home. Stay home if you're sick. Don't go out. Don't do these normal things. And in previous years, everybody's like, man, it's just a cold. I'm fine. I'm gonna. And they don't think about spreading that virus. When in fact, every year we should be cautious and caring about the people around us and caring about our own health. And I think this year now everybody it's kind of pendulum has swung maybe a little, I think probably a little too far in that other direction towards kind of overwhelming precaution.
So you're saying I should not have invested in masks? Is that what you're saying?
No, you didn't invest in masks. I'm going to, you didn't. But she
if
did.
I had, should I have?
But you did make the panic run to Costco, right? And the things you came home from, I was unloading the car. I didn't go with her to Costco. And unloading the car, I see the things here and I was like, coronavirus much?
Was I right about all the toilet paper? Was I right about that?
I don't think we're going to need mass quantities of toilet paper.
Because it's not really a GI
I don't
issue,
think our toilet habits are going to change with this bug. But I'm happy we've got it. We're well supplied. If anybody needs to use our toilet, we've got plenty of toilet paper.
And because of it, we're very rich. Here's a funny Jaeger story. One time we were visiting my parents, and my mom had a cabinet across from the toilet seat that was filled with like dozens and dozens of rolls of toilet paper. And my 3 or 4 year old at the time, many years ago, opened it and gasped for air. And he said, Mama is so rich. And I said, well, why do you think that? He was like, look at all the toilet paper. And so really, I just wanted to feel kind of wealthy.
You're right.
That's why I got all that toilet paper.
We're rich in TP at the moment.
Costco. Yeah. You know what's super crazy about the Costco run, though, was the line was as long as I've ever seen it. It was all the way back to the meat department.
Yeah.
But, and so I asked the guy in front of me, because I really wasn't thinking about why it would have been so, because I was just, I was doing some preparatory shopping, but I really was doing like other shopping. And I was like, why is it so busy? And the guy was like, do you really want me to tell you? And I was like, yeah. And he was like, Corona. And I was like, oh but then every aisle, there was still the little kiosk of food.
Right.
I was like,
while I'm in line panicking about coronavirus, I am
going to some of those cheese crisps.
I'm going to do some salsa while I'm here. Yeah, and
I thought that was
snack
funny.
on that.
Okay, so what's the difference between washing your hands with soap and water versus sanitizer? Because there's no sanitizer to be had. Should I make homemade sanitizer out of vodka, or could I just wash my hands with soap?
That's interesting thought, but no, I wouldn't recommend making your own hand sanitizer at home. There isn't any significant difference in washing versus using hand sanitizer if you're washing your hands well. If you're using soapy water, you're scrubbing. The recommendation is around 30 seconds or so, of scrubbing your hands. And if you're doing that, then you're getting an excellent cleaning of your hands, and 99.99% of the germs are being washed off. And so alcohol does that same effect when you really rub it around well and allow it to completely evaporate and dry. It's just the key is convenience. Mm-hmm. And one, you have to be at a sink with soap, and the other you can do while you're out and about. So when I'm working in the emergency department, I probably clean my hands with the sink 1 out of 4 times that I'm cleaning my hands. The other 3 out of 4 times I'm using alcohol as I'm moving into a room or coming out of a room or just touched a patient, that kind of thing. But they both work equally well. And so
you wear gloves, right? Come on.
When I'm seeing someone, yes, I'm using...
You always wear gloves, right?
Always.
Right. Just tell your wife that you're wearing gloves. Just tell her. It's just safer that way.
Sure.
Okay. Next question. All right. Those are all the preparatory questions. Now we have questions that people actually submitted to us.
Okay.
The first one is, has the media blown this out of proportion to diseases like the flu? By comparison.
Right. I truly do think things are a little blown out of proportion right now. This is a very interesting scenario that we have right now. I mean, it is a rapidly spreading virus. They're talking about the virulence of this virus as being very high.
Okay, what is virulence?
So virulence is how easily transmissible the virus is. Okay. And it is very transmissible because for all of the rest of the viruses that we've been exposed to previously, we have some bit of resistance. Because if you've seen this virus before, your body is kind of going to notice it and respond a little more heavily and kind of suppress the reproduction of it in your body. So it doesn't, other viruses don't spread so quickly because we've seen it before. Because this strain is new to us, it is more highly transmissible because our bodies don't have a indwelling kind of latent response to it. Mm-hmm. So in that case, it is impressive that it is going to spread quickly. The question is how severe is it going to affect us? And at this point, we don't know. We don't have enough data, I think, to be sure that we understand the severity of the illness. We're still very early on in this. And like I said earlier, many of the cases that have been tested to date have been the cases that were more severe. These were people with unexplained respiratory failure, and people were trying to figure out why are they in respiratory failure, and so they do this testing and they find this new virus.
In the United States?
Well, that was in China specifically. Okay. That's how they even found this virus. Okay. Is they had a cluster of patients with respiratory failure, and they couldn't figure out. None of their normal viral tests were picking it up. So they started investigating, and they figured out that this was a new coronavirus, and they tried to track it down. But and there's also, I was doing some reading today, and it's also clear that the virus is even continuing to mutate at this point.
Do you think we have more than one strain?
There is more than one strain of COVID-19, and some have more severe symptoms, some have less severe symptoms. And what I was reading today... Do we
have tests to know what strains are here or there or where?
I mean, in a CDC lab, they probably but the test that's being run through the health departments is just saying yes or no. COVID. Okay. Yes or no. But there are some different strains, and the severity is different between the different strains. They think that perhaps there was this one strain in Wuhan in China that was actually a more severe symptomology coming from it, as opposed to the one that's kind of spreading.
It's so devastating there, and I think that's why people are so scared.
Right, and I think what's going to happen as time goes by and we start having more data for how severe the symptoms are with this virus, we're going to see the mortality rate go down. And right now, people are estimating the mortality rate with the coronavirus, with the data that we have right now, to be about 10 times more severe than the flu virus. So to put some things in perspective, we have something like 30 million cases of influenza virus just in the United States every single year. 30 million cases. And I was reading today that there's estimations on an annual basis that deaths from influenza are close to maybe 30,000 people just in the United States die every year. So that puts the mortality rate at somewhere around 0.1% to 0.2%.
I'll believe you.
Somewhere there.
Get to that
Whereas
math.
what we're seeing with the coronavirus right this moment is about 10 times that. But you have to understand that we're testing so many more people with influenza, and we're testing people with very mild illness, whereas right now we're testing people selectively who are the most sick. And so that makes your mortality rate be higher. So I think as time goes by, we're going to see the mortality rate come down much, much more closely to what we've seen with either other coronaviruses or the flu virus in general. So that's why I'm not panicking at this point, because I feel like, yes, a lot of people are going to get coronavirus, but is it more devastating or deadly or significantly worse than any of the viruses that we have out there? And I'm not sure of that yet. I don't.
That's fair.
I'm not convinced that that's the case yet.
I accept that. Next question was, what do we do about traveling?
Yeah, so I think at this point, if the CDC, if nothing else, if you travel to a hotbed, the CDC is going to tell you to be quarantined. So, would I take a trip to Italy right this moment? No, I wouldn't, because when I got back, the CDC would tell me I have to stay in my house for 14 days, even if I don't have symptoms. So not that I'm afraid to go to Italy because I'm worried I'm going to catch coronavirus. That doesn't frighten me. But is it going to affect my life because I have to be quarantined when I get back? Yes, and that stinks, and so I wouldn't do it.
Okay.
So that is going to change on a regular basis as the virus spreads in different countries. So if you want to log on to the CDC, they have levels. They have like a level 3 travel warning, level 2 travel warning. So right now, any countries that have a level 3 travel warning, that would be places like Iran, China, Italy. These are places that the CDC says there's such high risk of contracting if you go there. Even if you're not symptomatic, we're going to make you be on a 14-day quarantine and isolation when you return. So that's a level 3.
Gotcha.
Then there are places who are currently level 2, like Japan, where you can go, and when you come back, you don't necessarily have to be quarantined, but you have to watch very closely for symptoms and just be very cognizant of what you're doing. But that's really it. But that's going to change as time goes by. So if you have foreign travel, I think you could at least consider your location of your foreign travel and what that means to you in terms of quarantine. Again, would I preach to you that you shouldn't go anywhere because it's morally a risk to your body to be going? No, I really don't think that. Note
to self: do not ask Matt to go for a spring trip to Rome.
Yeah,
noted.
Not going.
Noted.
And then domestic travel.
Yeah,
like
that's more the question.
I had a friend who asked me the other day. He was saying, we have a trip, to California coming up. Should I cancel my family trip to California? And I told him, no, I really don't think you should, because this virus, again, I don't want people to be afraid, because again, I'm not convinced this is going to be significantly worse to an individual than your risk of catching flu or other previous coronaviruses. But I don't think you should change your plans for domestic travel, because as this virus spreads, whether you pick up the virus next week when you take your trip to California, or you pick up the virus 6 months from now when you caught it, from the lady at Walmart, like you're probably going to get the virus. You have a pretty good chance. We all have a pretty good chance of catching this virus at some point, whether it's this season or next year or 5 years from now. Eventually, all of us are probably going to become exposed to this strain of coronavirus at some point. So do you change your life, dramatically right this moment when this thing is going to be in the wild forever now? Like, it's just out there. I mean, so H1N1 flu, again, I keep kind of going back to this swine flu thing because I feel like it's kind of similar and easy to understand. We still have the swine flu. Yes, we had an epidemic of it.
It was scary.
Yeah, we had an epidemic of it 1 year where it blossomed and it bloomed and exploded. But now when I test people for the flu every season, it's one of the many viruses out there. So this COVID-19 is going to be one of the many coronaviruses that is out there indefinitely. Nothing we do in terms of isolating and cleaning our houses and wearing masks is going to keep this thing from being in the wild and in nature indefinitely. It's out there. It's going to be out there. So we might get it this year. We might get it 5 years from now. We might get it 20 years from now. But at some point, our bodies are going to see this virus for the first time, and we're going to get sick from it.
Thank you, Pollyanna. I appreciate that.
I
really appreciate that. So what are proper self-quarantine measures to take if experiencing symptoms or exposure to corona? So let's break that down into two parts. Like if you have symptoms that are all of the things that are being told are symptoms of corona, like runny nose, coughing, sneezing, muscle aches, fevers, those are the things that the CDC says are, even though there's a difference between upper and lower, now I know the difference.
Right.
Some of the symptoms are upper respiratory, some are lower respiratory. What should we do if we have any of those symptoms?
So the vast majority of people right now who have any of those symptoms do not have coronavirus.
Like all the 4-year-olds in preschool probably don't have corona yet.
I mean, again, we've got cases in the hundreds right now, as opposed to cases in the 30 millions of influenza. So, like, do that math. Your chances of this being coronavirus when you've got cold and flu symptoms are extraordinarily low. So my advice to you is, if you have cold and flu symptoms, do exactly what you should normally do with cold and flu symptoms, which is stay home, wash your hands, cough into your arm or your elbow, not into your hand, wash your hands frequently, stay well hydrated, take Tylenol or Motrin as needed if you're having fever and achiness, and that's it. Don't go to your doctor. Don't go to the ER. You have a cold. And even if you have coronavirus, the new coronavirus, and you're having those exact symptoms, you still treat it the exact same way.
Because there isn't like an antiviral or any medication like Tamiflu or anything like that that's going to help you.
Absolutely nothing else to do.
And the only reason you might go to the doctor if you think you have the flu is because they could potentially give you a medication to help you, right?
Right. And so the threshold at which I would say you need to see a doctor is if you're in respiratory distress.
What does that mean?
So meaning I'm having difficulty breathing. Not just I'm coughing, but I'm short of breath. I feel like I can't catch my breath. I may be breathing fast or breathing hard. Those kind of things would say this has moved on from being cold symptoms to possibly something worse. And that's somebody who needs to be checked out. But that's the same advice I give for anyone who's having either cold or flu symptoms, that what to watch out for is respiratory distress. So take care of it like you would a normal virus. But then if you develop any kind of difficulty breathing or respiratory distress, that's when you really need to seek care, because that's when we might need to start doing extra supportive measures like oxygen or something like that.
Would you be concerned about any patient population that might be more at risk prior to those more severe symptoms? Right.
So the elderly is what we've seen so far, and I think probably everybody's heard that most of the cases of deaths that we've seen so far, especially here in the United States, have been cases of folks who were elderly with multiple medical problems, and therefore I would say the folks that are, you think of who are in a nursing home, or maybe who have chronic lung disease or heart disease or kidney failure, those folks are definitely at higher risk, and any viral infection can be very dangerous to them. So if you have family members who fit that criteria, I would recommend that they get checked out more frequently, just because they are at higher risk. The good news, everybody's been talking about this. You probably already heard this, but the good news is we've actually seen a lot lower complication rate in young children, whereas with the influenza virus, the highest complication rate are in the elderly, kind of the 65 and plus range. The next highest complication rate is the 0 to 4 range for children. And so we watch children with the flu a little more closely. And at this point, we haven't seen that bearing out with coronavirus, that kids and just young, healthy people in general seem to be doing very, very well with the virus.
Oh, good. That's reassuring.
Yeah.
Okay. What health measures can we take to improve our immunity, like in preparation for the exposure.
Sure.
Like, is there anything that we can do? Like that giant thing of Costco vitamin C with zinc, is that going to help me? Because I bought it.
So we got it.
Probiotics, we have them.
We've got all of the above. Do I think they're going to help me in any way? I'm not sure of that.
Are they going to help me?
They're going to help your anxiety level.
Okay.
You're going to feel like you're doing something.
Yes,
You're
that's
gonna
what
be
I want. This is what I want.
And that'll help you some. But will it prevent you from getting the virus? Probably not. So the regular recommendations...
Can they help me fight the virus, though? I get that it might not be an immunity issue, but like if my health is optimum and I have some deficiency in some sort of, I don't know, vitamin or nutritional thing, like if I keep my health up, will that help me?
Yes, I would say that. I mean, but that is regular sleep, like getting good sleep, again, staying well hydrated, having a well-balanced diet. If you don't have any of those things, then maybe you do need a boost. I am not an expert on whether or not on how vitamin C would work and whether or not it's helpful. It's not something that we often...
But you're still going to take it when I give it to you, right?
Yes, ma'am. I know when I just need to say yes, ma'am, and move on.
I bought the gummies. They taste really good.
Our kids are really excited about the gummies, that's for sure. But I would just recommend that, normal health maintenance and prevention as far as good diet, get some exercise, get good sleep, so that because if your body's under stress and you're not sleeping well, then your immune system is suppressed. Now, that being said, I did read one article today that was from a virologist, and he was recommending zinc. And he did say something about zinc lozenges, something about having the zinc in the back of your throat somehow prevented the virus from replicating in that area.
Newsflash, I'll go buy some zinc
lozenges. I don't know. That was one virologist's recommendation. I don't know how much science that's based off of, but
okay.
I thought that was interesting.
My vitamin C has zinc in it.
Does it?
I'm very jazzed about this.
All right. Well, you may have made a good choice.
Thank you.
Okay. As far as all of the other things out there from I don't know, herbals to oils and things like that, will most of those things help? I'm not sure that they will. Will they hurt? No, I don't think most of those things are going to hurt either. So it's not like they're going to be a detriment to your health.
Although when you're talking about like oils and things, I think that like maybe lavender is not supposed to be good for people with respiratory problems in general. So you probably really need to do your research if you're using anything
I have no
in the
idea.
world.
I have no idea about that.
I don't really know about that either, but I think I heard that or read that. So just double check me on
interwebs.
that.
that was on the interwebs.
All right. What are some good environmental precautions? And I want to preface this by saying I know that you're not a cleaning expert. I know who actually does the cleaning in your house. But as a physician, what are some things that you might recommend just environmentally?
Well, pretty much all your commercial cleaning solutions are going to work for viruses. So anything that kills, it's going to have a little label on there. It says kills 99.99% of germs. All of that is going to work just fine. And so just wiping down all of the surfaces, especially I'd say in your food prep areas and in your bathrooms, door handles, things like that.
Light switches.
Yeah, those are all great things that we should be doing. Again, every single flu and cold virus season in order to help the spread inside of our house. So just cleaning surfaces, I think would be number one. And then again, the main thing is what are you doing with your own body? Your hand washing, making sure. It was so funny. You were telling me about the lady who was on the state health department website. So they're saying whatever you do, frequently wash your hands.
Don't touch your face.
And then as you're doing about your day, don't reach up. Don't rub your eye. Don't stick your finger in your nose. Don't lick your fingers.
Don't bite your nails.
She's literally
behind the podium
telling everybody not to touch her face, and she can't get the pages to flip on her little thing, so she licks her fingers and flips the page, and we're all like, what are you doing? It's terrible. So that just goes to show how often we do that type of behavior. You want to tell them what we did to our own child?
Yes. Okay. So, pro tip, and my sister and I kind of came up with this in coordination, even unknowingly. paint your kids' nails with the not sucking your thumb, not biting your nails stuff. I think it's like Mavala is one of the brands that you can buy at like Ulta or online. Paint their nails, and when they put their little fingers in their mouth, they'll be so disgusted. It'll be a great way to deter hands and mouths for little kids especially. And then my sister did it for herself, and guess what's happening before I go to bed tonight?
You're putting it on?
I'm totally, and I'm not even a nail biter, but I think it's a great idea. We did get one question in that says, how long does the virus live on surfaces or in the air?
So I don't think we have enough information to know that for sure right now. I've heard varying reports on that. I think I
read 3 to 5 days on something.
Yeah, I mean, and I heard difference between like solid, like metal surfaces and fabric surfaces. And, I would say you should assume that for hours, surfaces are contaminated to as much as a day or two, probably. The air, the air circulates pretty quickly. These droplets fall out of the air very fast. And I would say within minutes to an hour or two, probably the air is fine in an area where somebody is positive.
One thing that I did read was that there is what is it called? The social boundary that's about a meter away.
Right. Social distancing.
That the social distancing helps with the airborne contagion because it falls quickly. Yeah. And within a meter's distance, you may have that might have added protection.
Yeah. And just, being right up in somebody's face, awkward, then obviously your chances of catching it airborne is much higher. But these droplets do fall and land on surfaces, and we really think the vast majority of cases are being communicated by somebody coughing and those droplets landing on a surface, somebody touching their hands and then touching their mucous membranes. We think that's the vast majority of cases are being.
I did read that one of the best ways to clean surfaces is not with aerosol sprays. So all that Lysol that we've been buying, y'all, all that Clorox spray is not actually the best way to clean things. I read from a professional cleaning service whose job is biodecontamination that the best way to clean surfaces is a solution of 5 tablespoons of bleach, just household bleach per gallon of water, and that you would wipe surfaces down. And the rule of thumb is clean before you disinfect it. So like if it's a dirty surface, wipe it down just with soap and water first to get all of dirt and grimy things off, and then disinfect the surface. That's the best practice in that regard. And then once you can totally use like pre-soaked like Lysol wipes and things like that just for like everyday cleaning multiple times a day. But if you're doing a deep clean, this is the recommendation.
But what if what you've got is the sprayer? Could you just like spray it on the cloth and then use that?
That's a good question. They didn't address that actually, but they did say that the spraying of the surfaces will kick up the contamination. Yeah. Potentially. Yeah. So these are professionals, okay? Don't question the professionals.
Sorry for the eye roll.
But an added precaution is like if you're using like household cloths and things, to soak them in that same a solution for at least 20 minutes to make sure that you have killed the virus on the cloth itself. So those are preventative measures and things. And now let's just for a little bitty bit talk about how to corona like a Catholic.
Okay.
Because like a lot of our dioceses are coming out with pretty stringent recommendations for what we should be doing in terms of like our church communities and going to mass and all of those things. And so I'm just going to go down the list and you tell me good idea, bad idea, why.
Yeah,
okay?
Sure.
So, and I'm going to use actually Archbishop Samuel Aquila from the Archdiocese of Denver's recommendations because they're very comprehensive. Like Bishop Taylor's from Little Rock, Arkansas, he had 4 things. Bishop Aquila's or Archbishop Aquila's is way longer. So we're just going to go with those.
Okay.
Removing holy water from the hand fonts and have hand sanitizer available at all entrances.
I love the hand sanitizer at all entrances, and the holy water. I am not sure how risky I doubt that there's much risk from holy water being a high rate of transmission. I bet if we did some scientific studies, that would be pretty low. But I think that's
But it's
reasonable.
still a surface. Like, you might touch the font, not just the water.
Absolutely.
So, yeah.
And you're touching your face. And so I think that's reasonable. I don't know how scientific that recommendation is, but I think it's reasonable. And I think that's a reasonable precaution at this point.
Okay. Next was suspend the exchange of the sign of peace or announce that it can be done with a simple bow. Also, no hand-holding during the Lord's Prayer.
Well, the no hand-holding during the Lord's Prayer.
Double eye roll.
That should have been done years ago. Somebody should have made it. Anyway.
From the Rad Trads here, y'all. It's really because we have boys and they squeeze each other's hands, and it just gets so raucous.
So, but I think the sign of peace thing is great because, you know, if I'm sick or I have a cold,
I do this all the time during flu season. The lady who's coughing behind me, I'm like, peace.
Yeah, big smile and a peace sign. I think that's great. I think people you're still getting across the community and the showing love to your neighbor, but we don't have to be touchy-feely.
We don't have to touch everybody.
I think that's
Stop touching people.
Stop touching those monkeys.
Okay, that was a reference to Flight of the Conchords. Isn't it? Flight of the Conchords.
Wait, touching those monkeys.
Okay. Suspend the distribution of the precious blood during communion. So the chalice.
Okay, so there actually have been scientific research studies done previously where they have actually swabbed and tried to swabbed an actual chalice, you know, with consecrated blood and everything. I think that is actually, and the risk is extremely low because they actually think that it might be your hands touching the bottom of the chalice more than it is your lips touching where somebody else has wiped. Because, I mean, there is alcohol there. Can the alcohol, you know, kill any viruses? Who knows there? But the risk is pretty low. But just the fact that you're grabbing that chalice and we're not wiping off the chalice is enough to say that, whereas when you lay your hand like this, the priest can actually lay the body of Christ in your hand in a way that he doesn't touch your hand. He can set it in there without touching your hand. And so I would just encourage folks, many dioceses have said it's still possible to receive on the tongue. I personally, just for the sake and the health of everyone else, how often have you received on the tongue and the priest has accidentally touched your tongue?
Hashtag my tongue has been touched.
All the time.
Yes.
All the time. So I would personally recommend you not receive on the tongue right now, not for necessarily for your health benefit, but so that everyone else's health benefit, and then take, you know, have good manners when you receive, and don't snatch. Just be patient. Let the priest lay it in your hand and then move on. But I wholeheartedly agree. I think at this point with the no chalice at the moment.
Be reverent. Make a good hand altar.
So that he can lay it in.
Exactly. Okay. Keep the gifts of bread and wine covered on the credence table. No offertory gift procession. So before the offertory, keep all things covered, and then don't pass an offering basket. How do you feel about that? I feel good about that.
I think he was.
I wish we had those things like on the sticks where the ushers would like push them down the aisles.
I mean, your money's so dirty anyway. You know,
money is dirty.
Pretty nasty.
Stop using money, people.
I think what they're talking about here is the procession of bringing them forward.
And keep them covered.
I don't think there's any risk there. I think to me, that seems a little bit
overdone.
What
if your 5-year-old was the one holding the unconsecrated host and he just like sneezed or something? Wouldn't you want that covered? I want it covered. I'm sorry. I'm not the
see what you're saying.
Doctor in this situation.
I see what you're saying.
I just feel like it's an abundance of caution.
Seems a little over the top to me, but okay.
All right. Reinforce procedures for having extraordinary ministers of communion sanitize their hands prior to the distribution of communion. Yes.
100%.
Yes.
100%.
Be extra vigilant that all vessels used during Mass are properly cleaned after each use.
I mean, we should be doing that anyway.
Right, by the proper ministers of purification.
Yeah, I mean, I saw that there was some recommendation that they were making sure to use antibacterial or a certain amount of kind of alcohol in what they were using. I I hope they're doing that all the time because that's year round.
If possible, do the collection in a manner that limits the number of hands touching the basket. Again, the basket on the stick. Do you remember those?
I think that's fair.
I feel like we need to make a comeback.
Fair. I'm electronic donations anyway.
Oh,
so,
that's true. We are. Although sometimes we do give our kid $1. Sometimes we do. We need to stop that. All right. Assure the faithful that they are not obliged to attend Mass if they are sick. And staying home can even be an act of charity towards their fellow parishioners.
Absolutely. I think people feel very compelled, and they don't want. They're like, well, I don't feel well, But is it a sin if I don't go?
Guys, this is not a time for scruples.
No,
it's just really not.
Just stay home.
Yeah, just stay home. If you're sick, stay home. You can actually have a spiritual communion in your home. You can read all of the readings in your home, and you don't put other people at risk. And I did want to say this. I actually have it marked in the Catechism. I'm going to read it because I feel like it's for those people who do suffer with scruples. I'm one of them. I actually get you. You're my people. Catechism Paragraph 2181 states, the Sunday Eucharist is the foundation and confirmation of all Christian practice. For this reason, the faithful are obliged to participate in the Eucharist on days of obligation unless excused for a serious reason, for example, illness or care of infants, or dispensed by their own pastor. Those who deliberately fail in this obligation do commit a grave sin. Okay, but this is a time of emergency. I mean, you said that just at the very beginning, like we might not be at epidemic proportions yet, but I mean, all of our shepherds, all of our doctors are saying, time is now for extreme cautions, people.
Right.
Not crazy town or panic, but like do the smart things.
Yeah, agreed. I think the take-home point, the thing when you said, how do you corona like a Catholic? To me, what that says is, how do we integrate what's going on in our spiritual life and our faith life? So not just how do we behave at Mass, but how do we take this, what's happening in our society and what's happening in terms of the anxiety level and the panic and the fear, and how do we wrap that in a cloak of Catholicism and faith and what to do.
How do we do that?
My thought is to do not let this coronavirus steal your peace. And if you feel, like I heard somebody else that said that their family members weren't going to be able to come visit because they were scared of contracting coronavirus. And in my opinion, don't change the way you're living your life in terms of doing the things that bring you joy, doing the things that make you feel loved, so visiting your family, taking a family trip, all of those things you should keep doing. And don't let this virus steal your peace. If we have a true understanding of where our peace comes from, where does spiritual peace come from? What gives us that? God, and an understanding that we are not made for this world, and that we have peace because we understand where salvation is and what Christ has done for us, and that is where we live in peace. And if we're somehow living right now with so much fear and anxiety about what's going on in our world, we're allowing our peace that should be blanketed over us because of our faith in God and Christ and what He's done for us to be taken away. And I would just encourage folks not to see and recognize that the fear you're feeling and the fear that's being pushed on us by the media is a detriment to our spiritual lives, and it goes against what God calls us to be, which is to trust in the Lord. I'm not saying fatalistic, or
even overly providential.
No,
like
I'm not talking
there's
about
nothing
that.
I can do. I guess I'm just going to have to,
But you trust in God. You understand that we're not made for this world anyway. And to do the things that we're called to do in love with the people we love. And don't let this steal your peace.
Right. And I actually did. I'm glad that you said that, because I just read. So I've been reading this book here. I don't know if you guys can see it. You probably can't see it. I don't know if you can see it. Yeah. So it It is Searching for and Maintaining Peace by Jacques Philippe. And you know I need this book. This is a book that I take with me to adoration.
Nice.
And I had just read, towards the end of the book, he quotes St. Francis de Sales, who's one of my guys.
Yeah.
And I just read this part. And it says, how to trust in providence. How do you maintain peace? And it says, do not anticipate the unpleasant events of this life by apprehension. Rather, anticipate them with perfect hope that as they happen, God to whom you belong will protect you.
Amen.
Yeah, right?
Amen.
Like that's where our peace comes from. And that is the peace that this world cannot give. Mm-hmm. And that's the peace
they
that
don't have it.
Yeah.
They don't all they know is this world, and anything that shakes their ability to receive pleasure in this world rocks their whole world.
Yeah.
And we have something more than that. We've been given more than that. We've been assured more than that, and therefore any little bumps that come along with whatever virus that comes our way doesn't change our standing with God.
Right. And again, we need to take proper precautions,
right.
but not overreact. And also, not overreacting, to be humble and obedient when our shepherds give us these prescriptions.
Right.
Because, that humility is such an important factor to the Christian life, to the Catholic life. Mm-hmm. And when we have pastors, when we have shepherds, when we have, authorities, even in the secular world, who have been given authority over us, telling us these are the things that you should do, then even if we think, well, that's just not my standard of holiness. Like, I should be going to Mass. They're telling you stay home if you're sick.
Right.
You're not more holy than the prudence of your pastor.
Yeah.
You're not more holy than the prudential judgment of those in authority over you, especially when it comes to things like this. I mean, absolutely, I would prefer to receive on the tongue. I have always felt that is more prudent, not even more prudent, but more reverential, I guess I should say. But in prudence and in obedience
right now,
and in humility, I know now this is not the time.
Right.
This is just not the time. It will return.
It will come back.
It'll come back. But I hope that holding hands during the Our Father doesn't happen.
It never comes back.
It never comes back. Oh, that was the other thing. So it wasn't in the Archdiocese of Denver, and I don't even remember which diocese it was, that they were discontinuing use of hymnals. And I know that there's some people out there that are hoping it's the Gather hymnal. I know.
Yeah, we just throw them away, burn them.
Gregorian chant only.
No, yeah. Burn. Yeah, let's add that to the list. Burn the Gather hymnal. No.
Glory be to Jesus. He is teaching us so many things, even in this time of worry and anxiety. And we hope that we've just brought a little bit of peace to your life this evening. Thank you for spending about an hour with us, about 45 minutes.
Wow.
I mean, we did this for a long time. We were really going to do this for about 30 minutes, but we just kept on talking because that's how the Jaegers roll.
Yeah.
Yeah.
You can't stop. We
Bye,
love y'all.
y'all.
Bye-bye.